Hello, my name is Leah Burke, and my research topic is malnutrition in newborns born to women post weight loss surgery. Congratulations, you're pregnant, or a friend or a family member is pregnant. This brings on big changes in any woman's life, hormonal changes, estrogen and progesterone skyrocket, causing many negative symptoms. Physical changes, weight gain, fluid retention, other not so great effects. Household dynamics change, adding another member to the family is a huge change. It can be very hard on your marriage or any relationship for that matter. When you add weight loss surgery to the equation, things get a little bit more complicated. The most common type of weight loss surgery is the gastric bypass. That's what you're seeing here in the diagram. The surgery reduces the size of the stomach, allowing the patient to eat less and lose weight. Many considering this surgery are morbidly obese or bedbound. They have diabetes, heart problems, chronic joint pain from the added weight they have to carry around. Whatever the reasoning is, it's often considered a life-saving surgery. The important thing to remember here is that less nutrients are absorbed as a result of the surgery. Maternal nutrition during pregnancy. Proper nutrition is crucial for anybody, especially a pregnant woman. A healthy diet and prenatal vitamins are standard. This is typically what the doctor will recommend when a woman becomes pregnant. A woman that's had weight loss surgery, on the other hand, has more needs than a standard woman, if you will. The health recommendations for her, unfortunately, are more scarce as well. And in these cases, when the mother doesn't get enough nutrients, the fetus is the one that will suffer more. Even when vitamins and minerals are given as supplements, sometimes these fetuses still do not get what they need. Another important factor in this discussion is the operation to birth timeline. It is the amount of time from surgery to pregnancy. It's often urged that a woman wait 12 to 24 months after surgery to get pregnant. This allows her weight to balance, and it lets her body adjust to its new normal after surgery. We see higher neonatal defects and complications when the woman does not wait the 12 to 24 months recommended. The complications can actually last up to 3 years, so it's often urged to wait longer as well. What's important here is the shorter the timeline, the higher the risks. In the first study that we'll be discussing, there were 2 groups that were compared. The non-operative mothers. These are women that were just from a generic population. They had not had any surgery and they had a healthy average BMI. The post-operative mothers was the group that had weight loss surgery. Their average BMI, as you can see, was a little bit higher in the unhealthy range. Babies born to women who'd had the weight loss surgery, such as gastric bypass, were smaller than normal at various weeks of pregnancy. So this is referred to as small for gestational age, or SGA. The instances of prematurity, birth defects, NICU admittance, these all went up in the postoperative mothers group. Congenital malformations. The NICU is the neonatal intensive care unit, which is a special wing for babies that need a little extra help after birth. The second study that we'll discuss, the methods were similar as the previous study. There were 2 groups of mothers. The postoperative mothers that had not had any surgery, They were given nutrient supplements after surgery and then asked to follow up with the hospital once they became pregnant. The instances of small for gestational age, low birth weight, these were found in this group of mothers, the postoperative moms. The babies also had lower cord blood nutrient concentrations. And these nutrients are so important during pregnancy: iron, calcium, zinc. Despite having regular supplementation before and throughout pregnancy, these nutrients were found to be low in the fetus. Again, in this case, in this instance, the test group had a higher BMI, which is important here because the higher instances of complications occurred in the women with a higher BMI. The third study was the most diverse set of participants. It utilized different surgical techniques, gastric bypass, but also the gastric sleeve and the adjustable gastric band. The sleeve reduces and removes the unused portion of the stomach. It is not bypassing. It's a very permanent form of this procedure. The gastric band is less permanent. It places a band at the top of the stomach, which still reduces the amount of food that the patient can eat in one sitting. Again, less invasive, less permanent. The important thing to remember here is that although these were different surgical techniques used, they still have similar outcomes post-surgery. The same instance in the post-operative group of moms, nutrient deficiencies were found in the mother and in the newborn. There were also 5 cases in this study of medical termination of pregnancy. This was due to the deficiencies and specifically folate deficiencies. So how can we combat this issue? This is a rising issue. The rate of overweight and obese women continues to rise. Thus, the rate of postoperative babies are going to rise. Spreading awareness and education and counseling seem to be the best ways to combat this. Spreading awareness like I am to you right now, education and counseling, doctor to patient. Women that have had weight loss surgery should be made aware of the consequences of not waiting the recommended amount of time. With these precautions, we can bring healthier babies into the world. Thank you.